we were here and someone fainted. Right, someone fainted, and right while that person was fainted, ekaparama or is like, I don't feel a heartbeat, or I don't feel a pulse. Right? What do we do? Exactly. So I'm just assessing how well you can't do it.
Better answer, please.
Right? What do we do? So now now I'm not going to explain because I don't want to waste my time. Yeah. Right. I don't want to explain. We will show you what we will do. Right, and how we will do it, right? So I need both of them because so as soon as it happens, right. So when this happens, this way of CPR, whenever what we call in the hospital, it's a code, right? It's a code. It's not one person. If it's only one person, then it's a problem. Then we need to get more people, because the more the people are, it will be much easier for us. Because like the way ORD must have explained, it is very, very tiring. Right, so we need to keep switching, and someone has to record. Record as in, record the details. What time this patient arrested? Why? Did ORD teach you all that? Why do we need to record the time?
Legal issues.
What legal issues? Why legal issues? Why legal issues?
Like if the patient dies, the doctor gets sued.
Yeah, but the thing is, for how long do I do CPR? That's the question. You understand? Because sometimes what happens is, there are a lot of times where we're doing CPR for 40 minutes, we manage to get the heart back, but what has happened? The brain is dead. So remember, this cardiopulmonary resuscitation is actually not for the heart, it's for the brain. The brain is the most important organ and the most vulnerable organ out of all. Little bit of time without blood, that is little bit of ischemia damages that. There is no repairable way to bring it back. So that is why we are trying to make sure that the brain stays alive, right? So, but there is a question as to how long we can go ahead. So that is why we need to know what time we started. Right? So ORD, you start, right? And I will help you with regards to this, right? So she saw, you check the pulse.
No pulse.
No pulse. You just do it. We will not talk, right? We will not talk. We just do it. And Vidhi will also come and help you with regard to the exchange.
So basically the area is safe.
Yes.
So I have to go and see whether the patient is responsive.
Not responsive, right?
If we can that the patient is manual.
Breathing. While she is doing that, you can feel the pulse at the same time, right? No pulse.
So call for help.
Yeah. So she said, yeah, patient is arrested. Imagine, right, or whatever, right? And she started CPR. So she doesn't wait. She said, someone come and do CPR. No, she starts CPR and tells me, and she's doing it. I was like, okay, right, I'm here. I've seen the time. What time is it? It's 12:45, right? Vidhi, come and help ORD, right? So what Vidhi can do at the same time in the hospital, she can actually, start putting a cannula, right? So you go ahead, okay, and then you have to give two, right? You do that. You go ahead and just continuously do it, right? So what Vidhi will do is, she will try to put a IV cannula and we'll give IV adrenaline or whatever that is required. Now imagine ORD is actually getting tired, right? So what ORD will tell is that, yeah, you do head lift, chin lift, till chin lift. Don't trust that. So now when she does 30, I will take over, right? So during that time of takeover, Vidhi, right, before she moves, at that time Vidhi will check for a pulse. Now while ORD is doing CPR, you can stop.
Oh, thank God.
Okay. While ORD is doing CPR, right? If there is a pulse, does that mean that the heart is back? Why? She knows it. I won't ask her. Why? Because she itself is pushing the blood. So obviously there's going to be a pulse. But I want to see if the heart is contracting on its own. So during that period of time where ORD is tired and is going to give it over to me, at that time the person who's actually on the head side, ORD won't do it. Because ORD is already tired. So the other person during that small interval will check for a pulse. If there is no pulse, right, in the hospital we actually put the leads and all, but if there is no pulse, the other person will continue CPR. And then we will wait for another 5 minutes and then we will assess. Right? So we'll do that rhythm. Okay. Right. Just do 1, 2, 3, 4, 5. I'll come and take over.
Okay. So I see 27, 28, 30.
Okay, right. 27, 28, 29, 30. Change, right? So at that time, Vidhi has checked the pulse, no pulse, right? I start. Right? So I'm going to go ahead. And ekaparama sometimes he'll start coughing. So that means he's already got his this thing. Then I will stop. right? Sometimes there are patients who push you away, but then they've actually, what the hell are you doing, right? So they've woken up. And then sometimes, even though there is a rhythm, right, the heart is not beating. So, there are a lot of different conditions. So it's just a matter of the reason I wanted to do this simulation is so that you all understand that it's not something one person did and that's it. It's teamwork, right? Like I said, she'll actually put a cannula, she'll give some drugs. Then there are other things that a lot of people will come and do because we can't just be using an ambu. We have ambu mask and all. We can't use that. We'll have to intubate the patient. So all of these things will be done simultaneously, right? Hope you guys learned. And I hope you all got a lot to learn. I know it was a lot of concentrated information, but hope somewhere down the line it was useful. Again, like the way I said, the whole point for this whole thing is so that you all acquire that taste, like, okay, I want to do medicine because this is fun, right? Apart from that, start actually processing the facts, whatever that you all have learned, your facts, into practically. Okay, I don't know if these people will now decide never to go into medical school. That's a different story. Right.
That's also a trick here.
Right, I think we're done now.
Okay.